Дякую вам за увагу. Я думаю, що ми можемо переходити до нашого основного спікера, професора Кеті Pritchard-Jones, яка обрана президентом SIOP на 3 роки. Професор Pritchard-Jones працює у Лондоні. Її науковий інтерес – це є солідні пухлини, тим не менше це є фахівець дитячої онкології з найвищого світового рівня. Дуже дякуємо пані Pritchard-Jones за те, що приділила увагу Україні. So, dear professor, thank you for joining us, and we are happy to have you here in Ukraine, and we would like you to speak about your vision of SIOP and the development of pediatric oncology in Ukraine. Thank you very much for dedicating so much of your time to our country, so it's an honor for us.
Thank you, Roman, and thank you, ladies and gentlemen, and I believe somebody from your Ministry of Health is also participating. It's a great honor for SIOP to be asked to join this first meeting of your National Pediatric Hemato-Oncology Society. And I'll just take a moment to share my screen. That's fine. And you know, your ambition, successful treatment of every child with cancer is possible in the Ukraine, I think, and your focus on education, research and collaboration is exactly, you know, the areas that SIOP wishes to support. Now, you have taken a great opportunity through clinicians working with the Ministry of Health to have the Ukraine adopted as a focus country for the World Health Organization. Really to facilitate networking, collaboration and mutual support between its members. We now have 2,600 members in 130 countries. That includes, I checked yesterday, only 5 official members from the Ukraine, but you certainly do feature. And our vision, like with yours really, is that no child should die of cancer, but we want cure for more and care for all. Now, how does SIOP operate? Well, we have 6 continental regions and they provide regional leadership and support, and they can help with advocacy, education and training programs often run at a continental level, promotion of research networks, interaction with parents, ensuring there's multidisciplinary coordination, and you fall within SIOP Europe, with whom I'm sure you're familiar, and I know you're in the process of applying to be a member organization, and the current president is Pam Cairns, who's also based in the UK. Now, within SIOP, we are a multidisciplinary society. We already have doctors, medical doctors, surgeons, radiotherapists, and so on as our members. We also have a very strong nursing group, and they were very active last year because it was the WHO Year of the Nurse and Midwife. And if you can, the slides I think will be available later. If you look at these YouTube links, you'll see some of the activities they've been doing around the world to do with COVID, but also to promote the speciality of pediatric oncology nursing, which is so important for success. Within SIOP, we also have a committee that's called the Pediatric Oncology in Developing Countries Group, PODC, which is really focused on helping low and middle income countries. And this is one of the major activities they've undertaken in recent years to adapt treatment regimens by specific disease type for different resource settings of care. And many SIOP adapted treatment regimens are already being applied very successfully in settings from countries as poor as Malawi to much better resource countries in Central and South America. Now, we've just launched last week, in fact, our new strategy, and you can find this on the SIOP website. There's a link there. And it really is to enable us to enact our mission to improve the lives of children and adolescents with cancer and the healthcare professionals that look after them through, supporting global collaboration, education, training, research, and advocacy. And we are developing now very detailed work plans, many of which align with recognizing our important role and partnership with the WHO. We are in official relations with WHO as an NGO, and we have some specific tasks to deliver in supporting the global initiative. Now, these are just data about where are the children with cancer in the world, and I'm sure you're familiar with the statistic that about 90% of the world's children live in low and middle income countries, with the vast majority in Africa and Asia, where the mortality rates are disproportionately high compared to the number of cases. And we all are here because we want to do something to address this inequality. Now, the causes of treatment failure for childhood cancer are actually very well understood and have been studied right around the world by many researchers who are SIOP members and St. Jude and others. And this is a diagram provided by Scott Howard, who works in the United States, was until recently our Secretary General. So the first big problem is children just not being diagnosed at all because they never make it to medical attention. I understand that's not really a problem in the Ukraine. Of course, accurate diagnosis and particularly risk stratification is critical to correct treatment, and that's becoming increasingly sophisticated. Now, some families, for whatever reason, may end up not having treatment or abandoning it. And one of the solutions for that is, of course, to ensure that the costs of childhood cancer treatment, but also the diagnostic phase, are covered by the National Health Service. Otherwise, in many countries, parents end up abandoning treatment because of their out-of-pocket expenses. Now, this shows you, and then the other causes of treatment failure are, of course, dying of the toxicity of treatment, which is perhaps more likely if cancer treatments are being given with inexperienced hands, and then relapse, which is a consequence of not giving the most effective treatment, or is just inherent to the biology of the disease. And what we're looking for, of course, is to cure as many as possible. And in high-income countries now, that cure rate is over 80%, just over. There's still a significant problem with relapse, but most of the other problems, causes of treatment failure, have been minimized. Whereas you can see here across the income settings, these have greater importance. And I think the Ukraine is in a rather unique position because you clearly have a well-structured health service and healthcare professionals, and you don't have problems so much with access to medical care or abandonment of treatment, although I suspect there'll still be some aspects of late diagnosis. It's seen everywhere. And you will need to think about which of these aspects you can fine-tune the most. But I suspect a lot of it is around giving the most effective therapies in the safest possible environment to reduce relapse and reduce toxic death. Now, in Europe, and I include what's happening in the Ukraine here, the differences are much more nuanced than they are if we compare Europe to Africa or Asia. And here are the 5-year overall survival at a population level for cancer cases diagnosed in Europe in the last decade, published back in 2014 by Gemma Gatter. And whilst the Ukraine doesn't feature here because I don't think you have got sufficiently reliable survival statistics at a population level, one suspects you're probably similar to some of the countries in Eastern European Union, where there is a marked difference of up to 20% or perhaps more compared to countries such as Germany, France, the UK, etc. But I would remind you, you have to you're in this for the long haul. Curing children with cancer is a marathon, not a sprint, they say, but also improving your national services and clinical outcomes is similarly a marathon task that you need to be consistent, and it can take many years. And on the right here, you see the survival statistics at a population level in the UK. In fact, we were at 60% back in the early 1980s. And it's only just now in 2010 that we've got to a just over 80% survival rate for all our childhood cancers together. So it is important to be in this for the long run and have a consistent plan with well-managed and planned time points at which you want to achieve certain milestones. So now I thought I'd talk a bit about the WHO Global Initiative for Childhood Cancer. I'm sure being a focus country, that everyone on this call is familiar with this, but just to remind everyone, it was launched in September 2018 with the Director General Tedros really supporting this. And it aims to double what is an estimated survival rate globally of about 30% in all low and middle income countries together to at least 60% by 2030. And how will that be achieved? It's really through increasing the capacity of countries to provide quality services for children with cancer, and to increase the prioritization of childhood cancer at the national as well as the regional and global levels. And this, how this is going to be translated into action has been given an acronym called Cure All. And this stands for the components, the pillars of action, which is what you're focused on in your meeting today, I'm sure, is talking about how one creates centers of excellence, or in fact, I think it's better to say centers of expertise, because I think we're all trying to be excellent at whatever we're doing, but it's a question of how you concentrate things together. And the care networks is a very important component of developing a high quality service for a country, as is ensuring you've got a sufficient, competent, multidisciplinary workforce. I've already mentioned the importance of childhood cancer being included in universal health coverage within a nation, that the whole professional group agrees standardized regimens for management and is able to evaluate and monitor how these are applied and what the outcomes are. And the underlying supporting enablers of this, of course, are advocacy to make sure the public are aware of childhood cancer, to promote early diagnosis, that the National Health Service is aware of the needs of children with cancer and the potential for curing most of them, etc. And of course, you need a government that's committed to prioritizing this and helping leverage finance and policies. And I know that you have now got detailed inclusion of childhood cancer in your recently published National Cancer Control Plan, and that's really one of the most important first steps on this road. And when the WHO holds a national workshop, and again, I'm sure you were all involved in this, there are sort of 10 core project areas where they ask the group that assembles over a couple of days to prioritize which 3 or 4 of these that are the top priorities for the particular national setting, and then to ensure that individuals are committed to leading this and they're properly supported and resourced. I won't list them all, you've probably seen this before. But to become a focus country, and I would congratulate you that you have done that, the government and Ministry of Health need to show a strong political commitment, and that the country needs to be anticipated to demonstrate early measurable progress for the success of the whole initiative globally, and that there should be measurable increase in capacity for the provision of services and the prioritization of cancer. And as you can see, Ukraine is here in the European region of the WHO, but there are multiple countries already participating, and the aim is to get to at least 50 countries within a few years. So people are looking to you to lead by example as to how this can be achieved. Now, the WHO has chosen 6 common tracer cancers for monitoring and evaluation. Now, these 6 represent just over half of all childhood cancers. They've got very high cure rates with proven therapies in higher income countries. They occur around the world, and by tackling each of these, you will need to piece together the multi-professional networks that you need to treat things from, eye tumors, brain tumors, abdominal tumors that require pediatric surgical oncology, through to the specialist diagnostics that we see in the hematological cancers. And of course, pediatric radiotherapy is needed right across the spectrum. So it's not to say you shouldn't be treating other cancers as well, but these are, because they're commoner, it's easier to monitor their survival rates and see how they improve over time with some degree of precision. So just to summarize, really, the WHO GICC is trying to address common needs around the world. And you've already taken several of these first steps, that children and young people are explicitly included in the National Cancer Plan, and that the plan is resourced so it can be delivered. Every country has a need for greater advocacy for early diagnosis and to ensure families are aware of the curability of childhood cancer. You are the workforce and create the infrastructure. And of course, it's no good having a plan if you don't have the appropriately trained people to deliver it. And similarly, reliable access to the necessary medicines and appropriate facilities is important. Now, for many years, it's been clear that getting involved in clinical research and quality improvement projects as an integral part of care is really important, not only to know where you are now, but to be able to see improvement over time, to innovate. It's very motivating for the staff to be involved in research where you can prove really what you've been able to achieve for your patients. But of course, research needs funding, and often for childhood cancer, this is somewhat hard to come by and often comes from philanthropic organizations. And then the fourth key point here is, of course, the quality of data. And I know you have a Ukrainian National Cancer Registry, and it needs to ensure it's got accurate data on the childhood cancer subtypes, and ideally with tumor staging according to the international consensus for staging childhood cancer. So just to run through a few examples of how SIOP Europe has been working within Europe, but I think even though you're not in the European Union, SIOP Europe covers Europe as a geographical continent, and I know that they want to reach out beyond the EU. And recently, Pam Cairn spoke at a webinar we held jointly with St. Jude to promote what we were doing to support the GICC. And she picked the 6th pillar, which is access to essential medicines and technologies. And so that you're aware of the work that's been done, because it may be useful to you for your project. They've already done a survey on access to essential medicines. This was led by Gilles Vassal. And you'll see here that, in many drugs in many countries, not all the necessary agents were always available. And some of the medicines were not covered within the National Health Service, which put up a financial barrier for parents to be able to receive the optimum medicine for their children. And then there's a general problem that often medicines do not come in a child-friendly formulation. And there's also unequal access to pain control during invasive procedures. And still there are children having to have lumbar punctures and sometimes even bone marrow aspirates without decent general anesthesia. Now this has evolved into an ongoing project, which is the COP Essential Medicines, and they're building a consensus-based reference list of medicines for childhood cancer that's appropriate to the European environment, and they are linking in with the WHO Essential Medicines list for children. And currently they're undertaking in 16 disease areas and really led by the young investigators, mentored by the senior members of these specific clinical trial groups. What are the essential medicines to treat across a whole range of childhood cancers according to European protocols? And they are synergizing this with another project that is being led through the European Reference Network for Pediatric Cancer, called ERN PEDCAN, where they are asking each of the tumor-specific clinical trial groups to define a European standard clinical practice guideline for managing these tumor types that would be expected at a European level. So again, if you are looking to standardize your normal protocols that are not part of clinical research, I think this work that's ongoing, you should very much aim to be part of it. Now, going back, gosh, it's over a decade, Poland 2009, with Professor Jerzy Kowalczyk, and he was supported by one of the previous First Ladies of Poland. We launched the European Standards of Care for Children with Cancer. And key areas included in the Standards of Care, and again, I think I'm sure you're addressing many of these. I've just put in bold some of the things that are perhaps most important. You know, the organized network of comprehensive care, which must include a shared care concept between the centre of expertise and an institution closer to home. And also the idea that some of the more complex procedures or very rare cancers might need to be concentrated in just a smaller number of ultra specialist centres. For example, in the UK, we treat retinoblastoma in 2 hospitals for the whole country. Bone tumours, we also have only 3 sites for surgery because of the complexity of replacing bones in young people. Whereas other commoner cancer types, every childhood cancer centre will be offering care. The National Register of Childhood Cancer, I know you have got big plans for this. You're also in your cancer plan defining in great detail the requirements of a pediatric hemato-oncology unit. And I'm not sure what it says about multidisciplinary staffing levels, but it's really key that you've got a comprehensive team and that they're sufficient in number to be able to access continuous professional development and also provide the same standard of care throughout the week and the weekend. And national standard protocols and access to research are really a key part of high quality therapy delivery. And then being able to monitor the patients you treat for outcomes and long-term side effects is very important. And these are some of the other aspects that are in the European Cancer Plan. But of course, it's there as a guide to be used for translation at a national level, and also for assessing what you're offering now and where you may have gaps. And it does emphasize very much the important role of parents, not only in supporting their own child, but also in building advocacy and support to other families coming through a unit and helping to develop facilities. Now, Jerzy led a survey of the standards of care in pediatric oncology centres, and the Ukraine is mentioned 15 times in this document, because I know several of you must have replied. And at that time, back in 2016, you were one of 6 countries that did not yet have a national cancer plan. But you were not alone. 5 other countries that responded did not. But I think that makes interesting reading that document. So to come back to what SIOP is doing, we have aimed to provide consistent support to our members and to their initiatives, and to give them tools and mentoring and other aspects of support to help them with local improvements and with collaborative research. So we have something called Point, which we do in conjunction with, it's a website where we host a lot of documents, but this may well evolve because the WHO is now launching a knowledge action portal to accompany the global initiative. And certainly the documents we hold here, we'll make them available through that as well. And as you probably all know, we hold an annual multidisciplinary congress, which last year was virtual. And this October, we don't yet know which way we'll go, but we're certainly planning an online capability of joining it. And I think there's probably quite a high risk it will be virtual again with the way COVID is evolving at the moment. As I've said, we provide regional clinical leadership with local knowledge and mentorship. We're developing an advocacy toolkit that members can adapt for their setting. And in implementing our new strategy, we are very much planning to encompass ongoing support to the GICC. So I think if the Ukrainian society has some specific things they think SIOP can help with, we'd be very interested to hear about them. Excuse me. Other things we've done at the beginning of last year, we were able to pull together 2 articles to give rapid guidance for COVID response. And we did these focusing on the 6 WHO tracer cancers with very specific recommendations. And I don't know if you use them at all in the Ukraine, but they were certainly translated into multiple languages even before they'd been published, because we made them available as preprints. Since the onset of last year, we've been in a formal partnership with St. Jude Global Program, and very pleased that Carlos Rodriguez Galindo made available the resources of St. Jude to set up this global collaboration space to address the COVID-19 pandemic and its impact on childhood cancer. And there's been a registry running there, which has now, sadly, you might say, got over 1,300 cases in it, but it is helping us document what's happening with COVID-19 infection in children with cancer. And Daniel Moreira, who runs the educational program for St. Jude Global, has led a COVID impact survey, which is currently in press, and I could certainly share that with you. It'll be out soon. I'm sure you're familiar of the collaboration of SIOP and St. Jude to get the adapted treatment regimens into practical way of working as adapted management guidelines. And that also involves WHO, the surgeons, the radiotherapists, and others. And these, again, will be coming soon, and they're going to start with Wilms tumor as the first example. So these will be really practical things for individual treatment centres and national networks to use to monitor how they're giving treatments and what the impact is. And then I thought to finalise, end up by saying, next Monday is International Childhood Cancer Day. It's also the day that WHO has chosen to launch the technical support package for the GICC. Tedros, the Director General, will be opening. SIOP's patron, who is Her Royal Highness Princess Dina Miraid of Jordan, will be speaking in that meeting, as will Bente Mikkelsen, who's the DG for non-communicable diseases at WHO. So I would encourage you, if you have time, to register for this webinar. Again, I've sent the flyer about the meeting to Roman so he can circulate it. It's taking place at 3 p.m. Geneva time, and it's 1 hour. And then I think there's a second hour, which is a bit more technical. So please do look out for that. And as you can see, of course, supporting International Childhood Cancer Day and the progress of the GICC involves many, many stakeholders, and it's important we're all at the table. So I'll end there. Thanks again for the invitation. If you have any questions, if you can send them in the chat, I think Roman can translate them for me, or I could respond by email. And thank you again for the invitation.
So, dear Professor, thank you for that lecture. So I was struggling with translation, but I hope it worked. But mostly we all want to learn English better. I think this is the for Ukrainian doctors. Дякуємо, пані професор, за цю лекцію. Я намагався зробити синхронний переклад. Прошу всіх мене пробачити за мої неможливо не зовсім швидкі переклади. Тим не менше, це не є моя спеціальність. Також я закликаю лікарів вивчати англійську мову. So we have a question about the registry in the chat. So what essential steps should be taken to begin setting up a national pediatric cancer registry? Because we have a national cancer registry with adults. Do you have any standard approaches? Питання полягає в тому, які є кроки в тому, щоб запровадити дитячий канцер-реєстр на фоні дорослого, яким ми вже зараз користуємося. So, can you answer, please?
Sure. So in parallel with the global initiative for childhood cancer, there's a global initiative for cancer registration. And as part of that, countries that want specific help to improve the pediatric element of an existing national cancer registry can ask for it. The project's been led from IARC, and I believe you're already in contact with Dr. Eva Steliarova-Fouché to help you. But, you know, the first thing is to get the coding adapted to childhood cancer, international classification of childhood cancers. Because that's one of the problems with using national general cancer registry data is it's not specific enough for children's cancers.
Thank you for that answer. I'll translate. So, на даний момент повідомлю тим, хто не знає, і тим, хто знає, то вони мене підтримують, що ведеться робота з фахівцями канцер-реєстру, які збираються провести проект спільно з нами всіма, і ми допоможемо їм по перекодуванню дитячих випадків відповідно до класифікації, яка відноситься до дитячого раку, зокрема з лейкеміями, нейробластомою, саркомами і так далі, оскільки наша класифікація не завжди відповідає дорослій. Таким чином ми не можемо правильно оцінити виживання. Це буде дуже великий проект, який дозволить нам, власне, зробити перший крок до якби не те, що окремого дитячого реєстру, але даних по дитячому раку. Також ми маємо можливість застосувати госпітальні реєстри, які пропонуються St. Jude Hospital, і це буде надано нам таку можливість, і я буду розповідати про це далі на цій конференції. I also mentioned the possibility to use St. Jude Cares Registry that is provided by St. Jude Research Hospital. This is very complicated for us, but still we started, and we will try to use this as hospital-based cancer registry and then unite all these efforts.
Yes, and may I make a second point? Oh, sorry. I was going to add a second point, which is I think it's very important that you have government legislative support for a national cancer registry to improve its childhood cancer data, and particularly to be able to link to national death registration so you can get your survival statistics. And you can only really do this with a the appropriate legal coverage. It has to be something in the national law that makes this mandatory.
Професор радить нам, і ми зробимо поки в тому, що на лікарів покладатися у збиранні усіх даних по пацієнтів – це дуже добре. Тим не менше, є так звана автоматизована збір інформації, який має бути забезпеченим законом з допомогою, як колись, як це не дивно робив Радянський Союз, з допомогою ЗАГСів, з допомогою заходів реєстрації цивільного стану. Таким чином ми будемо знати, що відбувається з нашими пацієнтами, які навіть випали з нашої точки зору. So, dear professor, there's also a comment that a lot of your points are reflected in the national cancer control program that we are going to launch in Ukraine. So, but we were never able to put them there without your previous expertise, because we just copied all your requirements and put it there. We are able to work with Ministry of Healthcare because they hear us.
Yes, I think it's great. It's great that it's all in the plan, but what's most important is that you're given the support and the time to develop it properly, make it happen. I'm sure you will. I wish you good luck.
Ми дякуємо пані професору і взагалі всім фахівцям за те, що ми користуємося, по суті, напрацюваннями їхніми для того, щоб їхніми рекомендаціями, щоб надавати нашому Міністерству охорони здоров'я чіткий план, тому що зрозуміло, що це вирішення Міністерства охорони здоров'я, тим не менше на план фахівці, які користувалися міжнародними рекомендаціями, багато з них включені в Cancer Control Plan на 10 років наперед. І нам побажали успіху і терпіння у їх імплементації, тому що це доволі тривалий процес. Чи є у когось ще питання? Професор буде рада також відповісти на них постфактум, якщо ви їх сформуєте у вигляді чату, і враховуючи графік професора, ми будемо відпускати і продовжувати нашу конференцію. So I also asked every attendees, so you see there are a lot of them, like 200. If there are any more questions, they will put it in the chat and then we'll address it to you. And if you have time, and you can respond to us. And we hope to see you once again. And thank you very much for your introduction to our first conference. Дякуємо.
Thank you again. And I won't stay for the conference because I won't understand it, but I hope one day to be able to visit the Ukraine. And thank you again for the invitation.
Професор рада буде, коли буде така можливість, навістити Україну. У нас попередній президент вже приїжджав і буде приїжджати, і ми будемо, чим більше президентів SIOP у нас буде, тим краще. So we had a previous president of SIOP in Ukraine a couple of times, so the more presidents of SIOP, the better it gets in Ukraine, so we will see you. And thank you once again, and have a nice, fruitful day. Thank you.
Okay, thank you.
Bye.